is an epidemic always a true epidemic? Or perhaps is the anatomy of the alleged epidemic something completely different from what is being widely portrayed? The major theme of virus mania is stated in the subtitle: how the medical industry continually invents epidemics, making billion-dollar profits at our expense. While to the uninitiated this might seem like a far-fetched idea, the aim of the book is to demonstrate that not only is this the case, but the problem has been building for decades. We're not saying that everyone is in on it. Most people are swept up by mass political and media campaigns and quickly stop asking fundamental questions about what other explanations might be closer to reality.
You take the red pill, you stay in Wonderland, and I show you how deep the rabbit hole goes.
I'm going to tell you about a strange phenomenon that happened in the United States over 60 years ago. An illustration of what can happen when politicians and the media get involved, and the subsequent manifestation of bizarre behaviour at a population level. The following account of what took place comes from a philosopher, Paul Watzlawick, in his book How Real is Real, and we also reference this in Virus Mania. In the 1950s, a strange epidemic broke out in the city of Seattle. Increasing numbers of car owners observed that their windshields were littered with small crater-like scratches. This phenomenon gained the upper hand so quickly that President Eisenhower, at the request of Washington State Governor Rossellini, sent a group of experts from the American Board of Standards to clear up the mystery. According to Don Jackson, who later summarized the process, the committee very quickly found that two theories about the windshields were circulating among the city's inhabitants. On the basis of one, the so-called fallout theory, recently held Russian nuclear tests had contaminated the atmosphere, and the radioactive deposit caused by this had been transformed into a glass corrosive dew in Seattle's damp climate. Keep in mind that this was a time in which anxiety about nuclear war was escalating. The Ashfelt's theoreticians, on the other hand, were convinced that the long stretches of freshly paved freeways, which Governor Rossellini's ambitious roadworks program had generated, sprayed acid drops against the previously untouched windshields, also influenced by Seattle's damp atmosphere. So there were two major theories in circulation, and it was probably a good thing that social media didn't exist. I can imagine that some of us would have been called fallout or asphalt acid deniers. Fact checkers perhaps declaring that yes, the science shows that the only way to get through the crisis is to keep your vehicle indoors with a windshield covering if you are going out in public. But fortunately, the crisis was resolved pretty quickly. It seems that in the 1950s, there were public servants who weren't so susceptible to hyped up theories and applied cooler minds to fundamental considerations about the windshield observations. Watzlawick continues with the story stating that, rather than investigate either theory, the Bureau of Standards men, bless them, turned their attention to a more primary issue. They established the fact that there was no increase in windshield pitting in Seattle at all. In truth, rather, it had come to a mass phenomenon. When reports of crater-scarred windshields began accumulating, more drivers began investigating their cars. Most of them did this by leaning over the glass outside and checking them up close, instead of doing it from inside and looking through the windshield from the normal angle as usual. From this unusual perspective, pits were found which are usually there but unnoticed in a car that is being used. What had arisen in Seattle then was an epidemic not of damaged windscreens, but rather of windscreen viewing. This simple explanation, however, was so deflating that the whole episode went the way of many sensation-causing reports, which the mass media first dish up as sensations, but the mundane explanations of which are kept quiet, leading to the immortalization of a state of disinformation.
Instead, only try to realize the truth.
What truth?
There is no spoon.
Alright, that's one type of epidemic that ended up being completely false, but it only involved cars. So now let's fly a little closer to the sun. We'll jump forward to April 2006 when the following events unfolded in the Dartmouth-Hitchcock Medical Centre in New Hampshire. Dr. Brooke Herndon, a medical specialist of internal diseases, developed a non-stop cough for several weeks. Because relentless coughing can be a symptom of pertussis or whooping cough, an infectious diseases specialist speculated that it could be the start of an epidemic. Things looked like they took a bad turn when over the next few weeks, more and more healthcare workers started coughing. The hospital took drastic action and almost 1,000 staff were put off work. A new rapid test kit was rolled out and their worst fears were realised when 142 people, or around 15%, tested positive for pertussis. Thousands of people were given antibiotics and a vaccine was also rolled out. Vaccine you say? I'll come back to that one soon. There were huge disruptions to normal hospital services, including a loss of beds available for intensive care. However, it took a sudden U-turn when it became apparent by the end of the year that the whole thing was a false alarm. Not one case of pertussis was confirmed with the gold standard, formally identifying the bacteria Bordetella pertussis from a patient sample. Yes, this is a microbe you can isolate and characterise and then run valid experiments in the lab or perform clinical experiments with. Medical journalist Jenna Colata explains what happened in a 2007 piece in the New York Times. At Dartmouth, the decision was to use a test, PCR, for polymerase chain reaction. It is a molecular test that until recently was confined to molecular biology laboratories. The good old days when PCR was being used as it was designed to be. Colata continues, now as they look back on the episode, epidemiologists and infectious disease specialists say the problem was that they placed too much faith in a quick and highly sensitive molecular test that led them astray. Infectious disease experts say such tests are coming into increasing use and may be the only way to get a quick answer in diagnosing diseases like whooping cough, Legionnaires, bird flu, tuberculosis and SARS, and deciding whether an epidemic is underway.
I'm trying to free your mind, Nia, but I can only show you the door. You're the one that has to walk through it.
As Dr. Trish Pearl, epidemiologist at Johns Hopkins, has assessed, there is no good data on pseudo-epidemics caused by over-reliance on these molecular tests. She was quoted as saying, "It's a problem. We know it's a problem. My guess is that what happened at Dartmouth is going to become more common." I thought the New York Times article outlined the false epidemic really well and am grateful it has been documented, but was surprised at some of the conclusions in the latter part, which suggested to me that some valuable wisdom from the episode was entirely missed. The involvement of Dr. Katrina Kretzinger, a medical epidemiologist at the Federal Centers for Disease Control and Prevention, seemed to put a different spin on things. After assessing the situation, she proclaimed, "The issue was not that they overreacted or did anything inappropriate at all." That seems like an odd conclusion to me, but the plot thickens in the following paragraph, which reads, "Before the 1940s, when a pertussis vaccine for children was introduced, whooping cough was a leading cause of death in young children. The vaccine led to an 80% drop in the disease's incidence, but did not completely eliminate it." This seems an exaggeration to me unless the experience in the US was completely different than other places in the world. With regards to pertussis vaccines, here's a chart that we've included in Virus Mania. It shows the death rates attributed to pertussis of children under 15 years old in England and Wales. Like many diseases in the last 2 centuries, it is clear that there has been far more at play than vaccination schedules to explain the massive decrease in deaths. As I discussed in my vaccines and the immune system videos, these kind of estimates of beneficial effects seem disconnected from reality. As children get healthier and their environmental conditions improve, they are far less susceptible to these diseases. Terrain theory, anyone?
Not quite what you were expecting, right?
So let's dig a little deeper to see if the CDC themselves have any evidence to back up the fantastic benefits attributed to the pertussis vaccine. If we go to the CDC website, they show the following graph. Firstly, this shows cases and doesn't tell us about death rates, which we want to know if it's claimed to be a leading cause of death in children. Secondly, it shows that the reported cases appeared to be trending downwards for at least 15 years prior to the introduction of the vaccine. And it doesn't show the trend prior to 1922, which would be good to know about as well. That's why I contacted my friend Roman Bystrianic, as along with Suzanne Humphreys, they have a goldmine of disease information on their website, dissolvingillusions.com. I would also strongly recommend their 5-star book, Dissolving Illusions, which reveals that modern medical interventions and pharmaceuticals have very little to do with the vast improvements in health we experienced last century. And sure enough, Roman had the chart I was looking for. This chart was put together from official US departmental statistics and shows that the death rates from pertussis were clearly in massive decline by the time a vaccine came into widespread use in the late 1940s. Probably why that sort of chart isn't promoted by the CDC. It's quite a stretch to claim that the vaccine had much to do with controlling the disease at all. This is one of the patterns we discuss in Virus Mania, that with an increasing number of conditions we're told to be on a high alert for, and the misplaced faith in indirect tests such as PCR, the alleged solutions are shutdowns, lockdowns and vaccines. Keep in mind that in the Dartmouth experience, the PCR tests were completely unable to diagnose infection and the vaccines were rolled out unnecessarily. Despite this, the position from some health officials is that it was still the correct response. However, this plays down the enormous cost and collateral damage caused by these measures, and based on historical data, it continues to overestimate the effectiveness of vaccines. Are we getting into some sort of loop here?
What did you just say?
Nothing, just had a little deja vu.
Now we get to another epidemic that I would like to discuss, but with this one we hit a little glitch in the matrix. In September last year, I interviewed Dr. Klaus Kernlein, specialist of internal medicine and author of Virus Mania. At that time, I had no idea that a week later I would be asked to join the team for the 3rd edition of the book. Klaus is a world expert in alleged epidemics, and my interview with him had 125,000 views when it was unexpectedly taken down by YouTube. He also did an interview in German with Russia Today, which had over 1 million views, which was also censored. But the good news is that my interview with him is alive and well over on Odyssey. If you haven't seen it before, I really encourage you to click on the link below in the description for what he called a PCR pandemic to complete the 3rd part of this investigation.
I'm going to hang up this phone, and then I'm going to show these people what you don't want them to see.
To help sustain my channel in this time of censorship, please support my work on Subscribestar. Link is in the description.